Let me turn to Teresa Boyd, who's the Assistant Director for Rehab Services for Vocational Rehab and Educational Services at the VA.
Thank you, and thank you so much for inviting VA to participate today in this summit. I want to take a few minutes this morning and talk to you about our Vocational Rehabilitation and Employment Program, commonly known as the Vet Success Program. This particular program in VA has a great mission. We are able to provide any benefits or assistance necessary to assist veterans with service-connected disabilities to prepare for, to obtain, and to maintain employment. We also, for those veterans who may be too severe to consider employment at present, we have an independent living program where we work with the veteran to overcome any barriers in everyday daily living activities. And hopefully, once those barriers are overcome, the veterans can then consider employment. We offer a wide variety of services, as you can imagine, because remember, our mission is that we can offer any benefit or assistance that will help a veteran become employed. So to that end, we have 57 different regional offices and 153 different outbases across the country. And we deliver our services by professional vocational rehabilitation counselors. We offer vocational evaluations, career counseling, guidance, and case management services. Certainly training is one of our very popular services that we offer. Most of the veterans we work with are in college-level training. We offer job seeking and keeping skills, as well as job placement skills. And once we place a veteran in a position, we also follow up with a veteran for a minimum of 60 days. That's to help with that whole onboarding process with both the veteran and the employer. Certainly, if a little bit longer adjustment time is needed, then we will continue to work with the veteran till we're assured that the veteran has made a smooth transition into employment. We have 5 different tracks to employment. The first is reemployment for those veterans that come back to us that have a job waiting for them and perhaps just need some job accommodations. We work with the employer and the veteran to make sure that happens. The second track is rapid access to employment. For those veterans in our program who are really in need of a job very quickly, they might already have the skills necessary and just require a little assistance in connecting with a veteran, with an employer who is hiring. Our third category or track is employment through long-term services. And this, as I said before, is our most important or most popular track. This is where we offer all our training. And in our program, a veteran can have up to 48 months of benefits to include 48 months of training. So the vast majority of our veterans are in this particular track. We also offer assistance with self-employment, encourage veterans who show talent in that area to pursue self-employment. The last track is what I spoke of earlier, independent living. A couple of things that employers may be interested in. We offer a very robust on-the-job training program where we help employers offset the cost of training individuals that we hire. We also have another program that's very popular, our Special Employer Incentives Program, where we can offset up to 50% of a veteran's salary when they start off to help the veteran, the employer, offset again the cost of training any loss in production as they're training the individual. These are for veterans that have great challenges in obtaining placement, rather perhaps through disability or age or any other kind of situation. We offer special employer incentives. We also can work with employers in workplace accommodations when necessary. We can hire rehabilitation engineers if necessary to work with the employer and make sure that goes smoothly. And that's part of that follow-along process that I talked about, the onboarding process where we can assist the employer. The last thing I want to talk about is vetsuccess.gov. That is a website we've developed where we register all of our veterans who are job ready. You can go on there and register as employer. go ahead and list any job openings you have and browse all the resumes of our veterans who are job ready. And the gentleman that spoke of Millicruit, it's very timely. I couldn't have paid you to make that comment because actually tomorrow VA is sponsoring a virtual job fair with Millicruit, and I encourage all of you to go on vetsuccess.gov to find out more information about that.
Thank you very much for those comments. And I, clearly the training is a huge issue and accommodation in the workplace. And I think, as I've spoken to some of the participants prior to today, one of their concerns was, and as the Secretary mentioned, there'll be 4 million new jobs. And I think we need to work very closely as a healthcare industry with you to talk about what those new jobs will be so that we're training folks for the jobs of the future and that there are opportunities for them to come into areas where today we may be shipping them overseas because we haven't developed those skills here. And specifically had that conversation with Karen, who works in a company that has a lot of overseas support, saying we can bring those back if we can just train these folks in these areas. So I think the notion of training in combination with the industry, I think creates lots of opportunity, and we need to work closely together with you on that.
Can just respond, the ideal situation for us would be when we work with both a veteran and employer at the very beginning of a program, because we could actually train that particular veteran very specifically for the job the employer wants, and the employer can weigh in with the type of training they would like to see.
That's great. Well, thanks very much. Let me lastly turn it over to Pat Geraghty. Pat is the President and CEO of Blue Cross Blue Shield of Minnesota.
Thanks, Rene. It's our honor to be here with all of the elected officials and appointed officials, the military leaders. We respect and honor your service, and the healthcare leaders that are here today. I speak on behalf of Blue Cross. Some of my colleagues are here today, Christy Bell, who spoke earlier. Also, we are an owner of TriWest, and so Dave McIntyre, who also spoke with us this morning, and we're very proud of our connections. I also want to mention that on behalf of Minnesota, we're very proud that we had one of the first states to have the 30-day and 60-day reintegration programs in our state that really look at the broad spectrum of issues: housing, family counseling, enrollment in VA benefits, mental health issues, and these are all very important support issues. In the interest of time, I'll just add one other thing to our deliberations this morning, and that really is about the support mechanism. We've talked about the support of the family, but the support in the workplace is very, very critical. It's not enough to assume that goodwill among your employee workforce is enough. And so one of the things I looked at in preparation for this session is we had a piece that went around our organization that helped everybody think about what are the issues when you have a returning vet coming into the workplace. What are the right kinds of questions? What are the wrong kinds of questions? What are the needs and issues that that vet will encounter coming into the workplace? We also recommended to folks to read the book Courage Under Fire. It's a book that just gives people a better perspective on the issues and challenges that that vet will face in the workplace. So I think those of us who are running organizations need to think about the messaging that we give our employees so that they understand that we want the environment to be welcoming, but we want the environment to also be understanding, compassionate, and informed so that a vet has the best opportunity to be successful when they join our organizations. Thank you.
Thanks, Pat, for the comments. Before we wrap up, any other quick comments or any other thoughts anyone wants to share? Marty?
Thanks, Rene. Marty Gavin. I run a children's hospital in Hartford, Connecticut. We're a fairly small employer. We have 2,100 employees. We have a lot. But it occurs to me in the next 12 months, with growth and new hires, we're going to have 300 new people coming to our place. And if I don't make this a priority, it doesn't become a priority. Some great things have gone on in healthcare. Haiti is a great example of that, of what we've reached out to as an industry and done great work in a crisis situation there. This is a crisis situation that we need to reach out to in the exact same way. But it has to be done by the people in this room. One thing we all have are great Rolodexes or Facebook contacts. And I just suggest as concrete things to walk away from here with is get 5 other companies involved. And probably the best way to personalize it, and something I will do, is get 5 resumes and find those people jobs. When you do that, then it becomes a priority. And thanks.
Thanks, Marty. And again, as we said earlier, healthcare is much broader than just health insurance or health services, but hospitals clearly and other areas that have direct delivery is critically important, and I'm very appreciative that Marty was able to come down and spend time with us. Sorry.
Hi, I'm Dr. Cohoon with the National Military Family Association. I really appreciate the opportunity to participate today. And our association has been saying for quite some time that behind every wounded warrior is a wounded family. And so really appreciate today that you all have been mentioning military families, because they do support the veteran on a lot of ways. And the biggest challenge is getting information to the veteran. And so I always think of the families as an opportunity to provide information, because then they'll be getting information as far as the veteran. Also, too, it's important to take in consideration that when the veteran is working, both full-time or part-time, that there is a potential impact on the family, which Dr. Scruggs brought up earlier, and so that you need to be cognizant of that as well. And then our association has been bringing out that there is a huge financial burden that takes place, because sometimes, a lot of times, the financial impact on the family, especially as the service member is no longer making what they were making before, that it now falls on the caregiver to move forward as far as to bring in some of that financial balance into the family. And so I wanted to make sure that when you're looking at jobs, it also may be to look at the caregiver or the spouse or the parent as far as opportunities for employment as well. Thank you very much.
Thank you. Thanks for those comments. And we've worked with the organization recently and have had great experience in partnering with Horizon to support you. So we appreciate your being here today. Let me be respectful of everyone's. Any other comments before we close?
There are 2 things that I've learned in this process that may be worthwhile mentioning. One is, you don't have an easy way to figure out whether someone's a veteran and sift through that. So as you're hiring and advertising and bringing things in, making sure that the very simple step of asking whether someone is a veteran when they're applying, or a family member of one that's serving, is something that's often missed by HR departments. It was certainly missed by mine. The second thing is, most of us have Guard and Reserve members in our employment. One of the things that I did was to take and place into HR one of the most recently returning Guard members, as a way to help his HR colleagues understand the value of what he found and what you need to look at and how you sort through that. And I picked him out of claims processing and found him a new career in HR. And it's changing the way in which our entire organization looks at that issue from an employment perspective. Because what I'll tell you is, as a CEO, you can sit down with your HR department and they'll wave and they'll nod and they'll say, yeah, I'm leaning forward, I'm doing my thing. But if they don't really understand it and they can't live it, then you got a barrier there. And simplest way to change that is to pluck someone who's been in your organization, understands your culture, but also been on the ground and can help their colleagues look at it in a very different way. And that's changing our culture dramatically in that space. So just a couple of thoughts.
Thanks, Dave. That's actually a great idea. No one has the experience other than someone who's been really through it. And having them be on the front line to identify and evaluate and recruit is probably a great idea and invaluable. Well, again, just to be respectful of your time, first of all, I think this has been great, and hopefully all of you felt it was worthwhile. It's not easy to take out a couple of hours out of folks' time, and I appreciate the commitment that you've all made to do this. I think the discussion is fantastic, and it's incumbent upon us to make sure that it continues, and then we capture this information and share it back. Magellan is obviously not the largest healthcare company in the country, but we've taken this on, I think, because of who we are in the mental health area, as I'm sure as Value Options and others, as a critical mission of our own. And I think, being aware of some of the things that Pam Hyde has said to us, both today and over the years, we take it very seriously. Mental health is a huge component. It's not the only component, but it's a huge component, whether it relates to the veterans themselves or their families or their communities that they live in. And we are committed to move this process forward and to continue to grow and aggregate, and as Marty said, to broaden the base of what we have from all aspects of healthcare, and we look forward to working with all of you to make sure that we do that.